Is SellyNue. Sorry about my swollen, fluid overloaded face right now. I woke up really full. Oh, joys of heart failure. Anyway, yeah, I just watched your video and your response. And, this just brings up so many issues for me because I've had a very similar journey in terms of family, and it becomes like this horrible guilt, respect, control triad where, okay, we're supporting you, you're dependent on us financially, so we should have a say. And yes, to some extent, I understand that, but when it comes to personal medical decisions, you're the one who has to go through the treatment. You're the one who has to actually do this. And when I first got sick, I read this article and it was like, loved ones need to remember that it's your disease, not theirs. And remain respectful. And it's tough, yeah, when you're disabled. People, it's not even conscious, but people lose respect for your autonomy as far as decisions. And with parents, I often see, and even siblings, a regression into you're a child again because you are dependent, and this is not good. A lot of us end up in really abusive, like, mind-messing situations because of this stuff. And the longer you're sick, I mean, there's like this arc of response, right? Like, first people are really, really sympathetic and concerned when you first get sick, and then they start to get frustrated when there's no solution and they want help, so they get like really, really involved and exhaust their fix-it impetus, which a lot of people get. And then ultimately they get discouraged and either learn to accept or they avoid and leave and don't want to deal with it. This is kind of how people react to somebody who's chronically ill. And it's really hell for us because you get in these situations where it's like, who am I making these decisions for? And what's really best for me? And it's hard. And there's this condition called financial abuse, and I went through this really bad when I came home from school, where the person who is responsible for your expenses lords it over you and makes you feel guilty and starts directing issues in your life with, under the guise of I'm your financial support, so you have to do what I say. And it's not cool. I'm glad you have your brother. Maybe he can be more of an advocate for you as far as the family is concerned. But it really sounds like, honestly, there's too many cooks in the kitchen. There's too many people trying to make decisions. And the bottom line is, everyone needs to remember that the ultimate decision is yours, and you're the one who has to go through it. You're the one who's sick, and you're the one who has to live with the ramifications of the decisions you make, not them. Okay? They can walk away and go be normal and go do their thing. You can't. They want you to take antibiotics for their peace of mind. You're the one who has to endure the consequences of that. And this whole, like, Dr. J versus your doctor that you have now, it's hard, honey. It's really hard. I know it's complicated, but just, if you would like some support in dealing with family, I'm totally here. I have quite a bit of experience in advocating for people in our positions, and maybe it would help. And if you wanted me to talk to them, I'd be happy to do that, or write a letter on your behalf or whatever. If we can find a way to involve them in the discussion to make them feel better, but remind them that this is your battle and your illness and your decision, it might help. Sometimes family just want to be part of it as a voice, If we can give them a constructive way to be part of the process without you being browbeaten and manipulated, it may be helpful. So let me know. Patient advocacy is delicate, but being on both sides kind of gives me a unique advantage of talking to family and stuff. So, about the Prozac, trazodone, Seroquel thing. First of all, I don't understand why. Okay, fine, the Seroquel, she doesn't feel comfortable. Probably because it's a controlled substance, and there's all this, phobia, paranoia about potentially abusable drugs. I'm not even going to get into that on this video, but trazodone is very commonly prescribed for sleep. Prozac is not going to take its place. Yes, trazodone is a weak antidepressant, but predominantly it's prescribed for sleep. SSRIs like Prozac can be helpful with your potency symptoms and some pain, because the same neurotransmitters affect us in that way. But Prozac is the most activating of the SSRIs, so it's not going to help you. It's not going to help the sleep thing at all. A lot of people have wakefulness issues on that drug. If you are going to take it, please take it in the morning. Or, check with your doctor on that. I can't be telling you what to do, but most patients take their meds in the morning because it's got a lot of activating activity. Second of all, it's not a sleep med. I don't know what they're trying to do with that. But you can take Prozac and trazodone together. Let me rephrase that. Clinicians often prescribe Prozac and trazodone together. I would definitely talk to your doctor or pharmacist if you have questions, but it doesn't have to be either or. And they're trying to throw too many rocks at the monster, as it were. And they're not even duplicate therapeutics. They're not even substitute therapeutics. So I'm not really understanding what's going on with that, or why families getting all freaked out. Also remember that this is really important, I should have mentioned this sooner, you can rescind those release and talking privileges at any time, or modify them at any time regarding who can talk to your doctors about what. And you may want to call and just adamantly reiterate and have them put a note in your chart that the only conversation to be taking place with your brother is about money, about finances and whatever. And anybody else can have specific privileges, and they need to put notes in your chart. It is not a free-for-all. Okay, you can talk to them, you can start making medical decisions for me and all of that. There's a difference between release of information and direction of care. So it is your right to call and modify those privileges if you feel that family is taking this in a direction which you had not foreseen and don't approve of. It's the law. This is your right. You are mentally competent. You are able to make decisions for yourself. And it's such a tough position when you're dependent financially, because there is a lot of guilt and feelings of obligation and stuff. I recognize that. I've been dealing with that for many years now, too. And it's not easy. the bottom line is, you are the center of all of this. You are the one with the illness. You are the one who should be making the ultimate decisions and living with the results. Family is not helping you by trying to take over. You know, you got 10 different people, 10 different ways they want to go, and it's going to pull you apart if you try to please everyone. It doesn't work like that. And yeah, I was serious about the family therapy thing. I think it may be very helpful for them to have some kind of therapy for dealing with all of the emotions that come, the anxieties that come with having a loved one who's very sick and not being able to fix it. And they need to stop trying to fix it. You're in very good hands now, and it would be great if they could support you. If they can't, that's their issue. So yeah, it's a delicate dynamic, and there's a lot involved, but just know you have a ton of love and support. In addition to us caring and being here for you, yeah, if you want to have some coordination of discussions going on, I'm more than happy to help. So, be well, sweetheart. I know this is so hard. You are loved. Follow your heart. Follow your intuition. She's your greatest ally. And don't cave in to people just because they're helping you. It's not a trade-off, okay? This is not you get total control because you're helping me. It's not cool. So hang in there. I love you, and I'll talk to you soon. Bye, sweetie.